Well, I'd like to start back in Kansas City in 2011. Um, I have, various doctors, primary care, dermatologists, gynecologists, and I go to them on a regular basis. And I started developing like an itch on my skin. I mentioned it to my dermatologist, and she just gave me some kind of a cream to help it, and it really didn't help that much, but it was not too extreme. So I went on a cruise with my sister in November of 11, and I just kept mentioning, I said, my arm just really itches a lot. And then I noticed as the year went on, my whole body would itch, and you couldn't even see anything. This itching just got miserable. It was particularly at night. I was just going crazy. So I went back to my dermatologist, I went back to my primary care doctor, and they both said, well, I don't know what else to do for you. I just didn't know what else to do, and it was affecting my quality of life. And Stan said, we're going to Mayo. He said, I want to have a physical, and I've been asking you to go up there sometime for a physical, but now we're going to go and find out. So we came up, and I went through all the various scheduled tests for a physical. And I was in the office, I think, of the cardiovascular consultant, and got a good report on my heart, and all my tests were looking good, except Martha, who is a practical nurse, I guess that's her title, and she was in that office. She noticed this mildly elevated, and she said, I'm going to order some tests. So she ordered the tests and told the doctor she'd ordered the test. Well, actually, she called Dr. Carlson, Kurt Carlson, I think his name is. And she told me that she'd ordered them. I went in, and she said, there is a large tumor on your liver. And I mean, I was just totally paralyzed with that news. So that's when it started with tests, and then seeing Dr. Shaw, and he said it's very, very large. It's on the right side, and it probably, if it can't be operated on, which it may be too large, the only real treatment would be a liver transplant. And I told Stan, and I just couldn't go. And finally they made an appointment with Dr. And they said he only does livers, and he is the best. And we'll see what he has to say. And he said we can remove it. No other organs were involved, and that the other side would compensate until it had regenerated. I went home for a week to get my affairs in order, and came back and started the surgery, and never has anybody seemed rushed or that I was imposing when I've seen them since. I just can't believe the experience that I've had here at Mayo. It's so positive. But my gratefulness extends to the entire team at Mayo, because to me that's what it took. Nobody gave up on me. Nobody said to me like my doctors in Kansas City. They just kept going, and they kept trying other tests, and then they consulted with each other. And even in the hospital in recovery, I felt like it was a whole team of nurses and the different staff of his. And I just felt if ever I had a chance, it was here. And to me, it's a miracle.